What would you most like the American people to appreciate about the broader impact of housing on health?
Yeah, I think the biggest thing that I want the American people to understand is that a stable, decent, affordable home is going to be the foundation for health.
What advice would you give to parents about the importance of stable housing on a child's development?
One of the key things that I want parents to understand is that a stable, decent, affordable home can be the best thing to help their baby's brain grow.
Can the quality of housing literally impact the development of a child's brain?
Yes, there's new evidence that the quality of housing can affect child brain growth. Professor Rebecca Levine-Coley at Boston College did a really interesting study looking at a lot of different factors that looked at how kids developed and did well in school, and housing quality was one of the strongest predictors. And so what our understanding now is that simple housing conditions, things like a home that's free of mold or free of pests or dust or other things, can be a really important foundation to kids learning and achieving in school.
As a pediatrician, when you ask parents about housing, what are you most interested in?
You know, I sometimes will talk about housing as a vital sign. It's something that we should be essentially taking on every patient that walks through our door. We do their height, we do their weight, we do their blood pressure. We want to understand those because we think of them as essential to health. And in many ways, I think of housing as being essential to my patient's health.
You've also described housing as a vaccine. What do you mean by that?
So housing is a vaccine that I came up with because I was trying to describe that housing was something that was not only important now, but in the future. And a vaccine is something that I think people understand, right? You get a flu vaccine not only to help you not have the flu when you get it that day, but to help you for the entire season. And I think that in many ways, that's what a vaccine is. That's what a home is for a lot of patients. It's something that not only helps you now, but helps you in the future.
What is the biggest challenge to increasing the connection between home and health? What do we need to do to overcome that?
We pay for a lot of the adverse consequences of not investing in housing. And in many ways, we know now that home matters. It's not a question any longer, does home matter? It's how much does it matter? How much should we be investing in this? And so when we think about not only the health of individuals, but of populations, we need to start being able to regularly invest in a home as a way to improve health.
So I'm an American off the street, any major city, town, rural community across the country. Why should I care about housing when it comes to my health?
Yeah. I think that one of the key things I want America across the board to understand is that housing not just affects an individual, it affects a community. So if the child sitting next to my child in class is homeless, my child's not going to learn as well. If the child that my children play with has mold and other things in their house and they're wheezing and other things, that's going to affect my child. And so when we think about investing in housing, it's not just investing for the person, the individual, it's investing for the entire community.